Now we will see the summary of parotid gland. Parotid gland is present in the parotid region. Parotid region is bounded superiorly by temporomandibular joint and external acoustic meatus. Anteriorly by ramus of the mandible and its attachments. Posteriorly by mastoid process and its attachments. Medially by styloid process and its attachments. Inferiorly by posterior belly of digastric. This region or this space what we call parotid mold, or we can also call as parotid bed or parotid region. Within the parotid region, parotid gland is located. This parotid gland is around 25 grams in weight and it is inverted pyramidal shape, so that it is having a base, apex, anterior border, posterior border, and it is extending in between the ramus of the mandible and mastoid process. It extends like this, so that it is having two surfaces, anteromedial surface, posteromedial surface. These two surfaces are meeting here. This border what we call medial border. Then just beneath the skin, superficial fascia and deep fascia, here one surface is there. This surface what we call superficial surface. Let me tell you one more time. Parotid gland having base, apex, anterior border, posterior border, medial border, and it is having anteromedial surface, posteromedial surface, superficial surface. These are the presenting parts. Now we will discuss what are the relations of different presenting parts. Apex related with the cervical branch of facial nerve and anterior and posterior divisions of retromandibular vein. Along with that, posterior belly of digastric. These are the apex relations. Then base relations. Base is related with external acoustic meatus, temporomandibular joint. Then auriculotemporal nerve, superficial temporal vessels. Along with that, temporal branch of facial nerve. These are the relations of base. Recollect, external acoustic meatus, temporomandibular joint, superficial temporal vessels, auriculotemporal nerve, temporal branch of facial nerve. These are the relations of base. Then anterior border relations. See here, cervical branch went with apex, temporal branch went with base. What are remaining? Zygomatic branch, buccal branch, marginal mandibular. But this buccal branch will be divided into upper buccal and lower buccal. So anterior border related with the zygomatic branch, transverse facial artery. Of course, it is branch from the superficial temporal. Then upper buccal, parotid duct, lower buccal, marginal mandibular. If it is accessory gland will be present. Clear? So these are the anterior border relations. Then the posterior border, it is resting over the sternocleidomastoid. If you write that much, that is sufficient. If you wanted to write still more, posterior auricular vessels and nerves. That's it. Then anteromedial surface, posteromedial surface, superficial surface. First, if we take the superficial surface, skin, superficial fascia. Within the superficial fascia, you can find the branches of great auricular nerve, platysma, rhizorius. Along with that, superficial parotid group of lymph nodes. Then deep fascia. That deep fascia what we call parotideomasseteric fascia. These are the relations of superficial surface or lateral surface. Then what is this surface? Anteromedial surface related with the ramus of the mandible and its attachments. That means what? Laterally masseter, medially medial pterygoid muscle. Then facial nerve, because it is emerging out. So ramus of the mandible and its attachment, facial nerve, then temporomandibular joint. These are the relations of anteromedial surface. Then posteromedial surface. This is the posteromedial surface. Posteromedial surface relations you have to remember in only 3 sentences. Mastoid process and its attachment, styloid process and its attachments, carotid sheath and its contents. So mastoid process and its attachments means mastoid process, sternocleidomastoid, posterior belly of digastric. Styloid process and its attachments means stylohyoid, styloglossus, then stylopharyngeus. Then carotid sheath and its contents, internal carotid artery, internal jugular vein, and last 4 cranial nerves. Of course, genuine content is vagus nerve only. Remaining 3 nerves, they pierces the carotid sheath and comes out. Along with that, facial nerve and the transverse process of atlas, rectus lateralis. So these are the relations of posteromedial surface. Then what are the structures which are present within the substance of the gland? See here, external carotid artery, retromandibular vein, deep parotid group of lymph nodes, then facial nerve. These are the structures which are present within the substance of the gland. Then what are the processes? See here, accessory process, facial process, then carotid process, glenoid process, then pre-styloid process and the pterygoid process. These are the different processes. Clear? Then if you coming to the duct, parotid duct is arising from the anterior border of parotid gland. It runs forward over the masseter muscle. When it reaches to the anterior border of the masseter muscle, it abruptly turns medially and pierces 3 B's. What are these 3 B's? Buccal pad of fat, buccinator muscle, buccopharyngeal fascia. After that, it runs obliquely in between the buccinator muscle and the mucous membrane. Then, when it reaches at the level of crown of upper second molar tooth, where it pierces the mucous membrane and opens into the vestibule of mouth. Right? So, this is about the parotid duct. This duct we can also call as Stenson's duct. Since it is having oblique course, when you are blowing air, this parotid duct is not inflating and it is acting as wall. So, that's it about the parotid duct. Then coming to the blood supply. Arterial supply is by external carotid artery. Venous drainage is by retromandibular vein. That's it. Then lymphatic drainage. There are superficial group of lymph nodes are there and deep group of lymph nodes are there. That means superficial and deep parotid group of lymph nodes. Efferents from these lymph nodes draining into the jugulo-digastric lymph node. Clear? So, that is about the lymphatic drainage. Then nerve supply. See here, sympathetic nerve supply is there, parasympathetic nerve supply is there. If you take the sympathetic nerve supply, preganglionic neurons present in the lateral horns of T1 and T2 spinal segments. From there, preganglionic fibers enters into the sympathetic chain and ascends upwards to the superior cervical ganglion. Within the superior cervical ganglion, relay will take place. That means preganglionic fibers will end, postganglionic fibers will start. These postganglionic fibers, they forms plexus around the external carotid artery and supplying to the parotid gland. That's it about the sympathetic innervation. Then coming to the parasympathetic innervation. Parasympathetic innervation is secretomotor. That means because of this innervation only parotid gland is secreting. So, if you take the course of it, preganglionic neurons present in the inferior salivary nucleus, which is present in the pons. Then those preganglionic nerve fibers, they pass through the 9th cranial nerve and they pass through the tympanic branch of 9th cranial nerve, or we can also call as nerve of Jacobson's. Then it reaching to the middle ear cavity and forms a plexus. That plexus what we call tympanic plexus. From the tympanic plexus, lesser petrosal nerve is arising. That lesser petrosal nerve reaches to the middle cranial fossa. Then it passes through the foramen ovale and reaching to the infratemporal fossa. Within the infratemporal fossa, there is a ganglion. That ganglion what we call otic ganglion. Within the otic ganglion, relay will take place. That means preganglionic fibers ends, postganglionic fibers are starting. Those postganglionic fibers, they pass through the auriculotemporal nerve and they supply to the parotid gland. The terminology which you have to remember in relation with the secretomotor innervation is inferior salivary nucleus, 9th cranial nerve, tympanic branch of glossopharyngeal nerve, tympanic plexus, lesser petrosal nerve, otic ganglion, auriculotemporal nerve, parotid gland. This is about the gross anatomy of the parotid gland. Then if you come into the applied aspects, any swelling of the parotid gland leads to severe pain because of the tight adherence of parotideomasseteric fascia. Mumps virus leads to inflammation of the parotid gland. That will leads to pancreatitis and archiditis, which leads to sterility. Then any infections in the oral cavity, they may spread through the parotid duct and reach into the parotid gland, which leads to parotid abscess. To drain the parotid abscess, you have to make horizontal incision. That too very small openings. Operation or that method what we call Hilton's method. Then Frey syndrome. Frey syndrome is nothing but when you are eating, along with salivary secretion, there will be sweating over the parotid region. That is what we call Frey syndrome. That is happening because of the cross communication between the secretomotor fibers and pseudomotor fibers. That means parasympathetic fibers and sympathetic fibers which are supplying to the sweat glands during regeneration, which leads to salivation and sweating over the parotid region. That syndrome what we call Frey syndrome. Then tumors. There are two types of tumors are there, benign tumors and malignant tumors. Benign tumors are slow growing and not affecting the facial nerve. But malignant tumors grows faster and they affect the facial nerve. Then whenever if you wanted to remove the parotid gland, you have to work along with the facial nerve. Actually facial nerve will be passing through the narrowest part of the gland, that is what we call isthmus. Inside the isthmus, deep lobe, outside the isthmus, superficial lobe. Clear? So this is about the summary of parotid gland. That's it for this session.